Cancer is one of the most feared diseases of the 21st century. It can affect anyone, at any time. While we've made great strides in treatment, it's still a disease that claims far too many lives. The good news is that cancer is often treatable when it's caught early. That's why it's so important to be aware of the signs and symptoms and to see a doctor right away if you notice anything unusual. In this video, we're going to discuss 10 cancer symptoms that you should never ignore. These are symptoms that are often overlooked or dismissed as something minor, but they can be early warning signs of cancer. If you are experiencing any of these symptoms, please consult with a healthcare professional. Our next symptom is one that can be a little bit scary to think about, feeling a lump or mass in your body. Most of the time, lumps and bumps are harmless, but sometimes they can be a sign of something more serious, like cancer. Cancer can cause lumps or masses to form in a few different ways. Sometimes the cancer itself will form a lump. Other times, the cancer can cause the lymph nodes to swell, which can feel like a lump. The lymph nodes are small, bean-shaped organs that help to filter out toxins and fight infection. They are located throughout the body, but they are especially concentrated in the neck, armpits, and groin. When the lymph nodes are swollen, it can be a sign that your body is fighting off an infection, but it can also be a sign of cancer. If you notice a new lump or mass, it's important to see your doctor to get it checked out. Early detection is key when it comes to cancer treatment.
I found a lump in my breast one morning while I was getting ready for work. I went to my doctor right away, and I'm so glad I did.
Have you ever lost a significant amount of weight without trying? While this may seem like a welcome change for some, it can actually be a warning sign of an underlying medical condition, including cancer. Unexplained weight loss is defined as losing 5% or more of your body weight over a period of 6 to 12 months without making any major changes to your diet or exercise routine. There are a number of reasons why cancer can cause weight loss. Cancer cells can release substances that interfere with your body's metabolism, making it difficult to maintain a healthy weight. Additionally, cancer treatments like chemotherapy and radiation therapy can cause side effects like nausea, vomiting, and loss of appetite, which can also lead to weight loss. If you are experiencing rapid and unexplained weight loss, it's important to see your doctor to determine the underlying cause.
I lost 15 pounds in just a couple of months without changing anything about my lifestyle. Don't ignore these signs. Get checked out.
We all get sick from time to time. It's normal to experience symptoms like fever, nausea, and vomiting when we're fighting off an infection. But what happens when these symptoms persist for an extended period of time?
If you have a fever that doesn't go away, or if you're experiencing nausea and vomiting that lasts for more than a few days, it's important to see your doctor. These symptoms could be a sign of something more serious, like cancer. Cancer can cause these symptoms in a few different ways. Sometimes the cancer itself can cause inflammation, which can lead to fever. Other times, the cancer can release substances that trigger nausea and vomiting. It's important to remember that not everyone who experiences these symptoms has cancer, but it's always best to err on the side of caution and see your doctor to get checked. Our skin is the largest organ in our body, and it's also one of the most important. It acts as a barrier, protecting us from infection and injury. It also helps to regulate our body temperature and allows us to sense the world around us. Because our skin is so important, it's important to pay attention to any changes that we notice. Changes in skin color, new moles, or sores that don't heal can all be signs of skin cancer. Skin cancer is the most common type of cancer in the United States. It occurs when skin cells grow out of control. There are three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma and squamous cell carcinoma are the most common types of skin cancer. They usually develop on areas of the body that are exposed to the sun, such as the face, ears, neck, lips, and backs of the hands. Melanoma is the most serious type of skin cancer. If you notice any changes in your skin, it's important to see a dermatologist right away. Conditions. Chapter 8. Persistent cough or hoarseness. A persistent cough or hoarseness can be a sign of something more serious, such as cancer. A cough is a reflex that helps clear your airways of irritants. It's usually caused by a virus, such as a cold or the flu, and will typically go away on its own within a week or two. Hoarseness is when your voice sounds raspy, strained, or breathy. It can be caused by a number of things, such as overuse of your voice, a cold, or allergies. However, if you have a cough that lasts for more than a few weeks, or if you have hoarseness that doesn't go away, it's important to see your doctor. These symptoms could be a sign of lung cancer, throat cancer, or another type of cancer. Lung cancer is the leading cause of cancer death in both men and women. Throat cancer can affect the voice box, the vocal cords, or other parts of the throat. If you're concerned about a persistent cough or hoarseness, see your doctor to get it checked out. Chapter 9. Changes in bowel or bladder habits. Changes in bowel or bladder habits such as constipation, diarrhea, blood in the stool, or frequent urination can be signs of a number of conditions, including cancer. Constipation is a condition in which you have fewer than 3 bowel movements per week. Diarrhea is a condition in which you have loose, watery stools 3 or more times per day. Blood in the stool can be a sign of a number of conditions, including hemorrhoids, anal fissures, and colorectal cancer. Frequent urination is a condition in which you need to urinate more often than usual. If you experience any of these changes, it is important to see your doctor to rule out any serious underlying conditions. Early detection and treatment of cancer can significantly improve outcomes. Chapter 10. Unusual bleeding or discharge. Unusual bleeding or discharge from any part of the body is a red flag that should never be ignored. While it can be caused by a number of factors, it can also be a sign of cancer. For example, unusual vaginal bleeding between periods, after sex, or after menopause can be a sign of cervical cancer or endometrial cancer. Blood in the urine can be a sign of bladder cancer or kidney cancer. Blood in the stool, as we discussed earlier, can be a sign of colorectal cancer. Other types of unusual discharge can also be a sign of cancer. If you experience any unusual bleeding or discharge, it is important to see your doctor as soon as possible. Early detection and treatment of cancer is essential for improving outcomes. Outrow, stay informed, stay healthy. We've covered a lot of ground today, and I know it can be overwhelming to think about all of the potential signs and symptoms of cancer. But it's important to remember that knowledge is power. By being aware of the early warning signs, you can take steps to protect your health and get the treatment you need if you do develop cancer. If you notice any of these signs, please consult a healthcare professional immediately. Early detection and proper management can significantly improve outcomes. Stay informed, stay healthy.